What is going on, everybody? This is Dr. Grimmett from Forge Physio. Today we're going to go over our side lying knee roll. So this drill is designed to take our femur and our pelvis and move them around each other. This is a drill we like to use a lot with people that have some hip tightness, some hip stiffness, just lack of mobility in their hips, and even those with low back pain. So the femur and the pelvis have different orientation to each other relative to which one you're defining. So what I mean by that is the pelvis has what's called an acetabulum, which has this kind of like concave type surface, and then the femur, the thigh bone, has this head that's just a convex surface. So if my femur is fixed or my thigh bone is fixed and my pelvis is moving around that, it's just going to change like relative motion. So we like to use this drill to put us into a hip flex position and start to kind of use our adductors to move our pelvis around the femur. So when I get set up, I'm going to go to a wall and I'm going to have my knees bent to 90, my hips flexed to 90, and I want to get into just a little bit of dorsiflexion. If I bring my foot out in front of me too far, it takes away that 90 angle and I'm more in a what we call plantar flex position. So on my side, on the wall, I'm going to have my knees bent to 90. My ankles are directly under my knees, hence the 90 position, hip flex to 90. And then I want to get nice and tall in my spine, but I don't want to arch my low back. Oftentimes when I say get tall, people will really stick their chest out and they arch their low back, and then they immediately feel some uncomfortable sensation in that bottom hip. You want to think about taking your ear, your shoulder, and your hip bone and keeping them perfectly in line. So nice and tall with a slight pelvic tilt. So I'm tucking my hips kind of under me. And then all I'm doing in this position with my head supported is I'm trying to keep my feet cemented on the wall. And I'm going to drag this top thigh on the bottom thigh and go forward and back. Forward and back. And once you can do that minimal motion without cheating in your low back, then you can kind of start exploring how far back you can come without allowing that knee to pop off, and how far forward you can go without just rolling your entire torso. So we're trying to dissociate our lower extremity, meaning our pelvis and our thighs, from our upper extremity. And then we can try to pair some breathing up with that. And then I would flip over and do the same thing on the opposite side. So again, this is not a drill that should be super strenuous. You shouldn't get any sort of pinching sensations in the hip. A lot of times if you're getting that uncomfortable sensation in the front of the hip, you're really arching the back. You want to check to see if your ear, your shoulder, and your thigh bone are in line. Slight posterior pelvic tilt will take you out of that pinching sensation. And then you're trying to keep that top thigh rubbing along the bottom thigh, going for maximal amount of motion.